guys, it's Dr. Mayank here. We're here today for the final part of the NUHCS Heart Failure Team Hijack series. Did you guys know that the heart failure teams of NUHCS span across not just the Kentridge campus, but also the Jurong Health campus? Well, I'm here today to hijack some of my colleagues from Teng Fong General Hospital to find a little bit more about who they are and what they do here. Hey guys, looks like Pofan's running heart failure clinic today. Let's go speak to her. Hi Pofan.
Hi Mayank. Hello Dr. Mayank. Nice to see you.
Can we have a few minutes of your time?
Sure, have a seat.
Thank you so much. Pofan, have you had lunch?
Yep, we had noodles across the bridge. You should join us sometime.
Sounds great. I'll definitely do that. So we wanted to ask you a little bit more about your career in heart failure.
Sure.
What specifically do you think is the most rewarding aspect of your work in heart failure?
I guess it's working as part of a multidisciplinary team where I get to work with a nurse and a pharmacist in providing holistic care to get the heart failure patients better. And it helps that our nurse, Sister To, is often chirpy and cheerful even when the load is very high. Yep.
That's great. Thank you so much. Hi, Sister To.
Hi, Dr. Mayank.
How have
Nice
you
to
been?
see you.
It's good to see you too. We wanted to ask you a few questions as well, if that's okay.
Yes, sure.
So, could you describe to us what is a typical day like in your life at work as a heart failure specialty nurse?
Dr. Mayank, have you ever traveled on the bullet train?
Yes, I have.
Okay. My day actually passes like the speed of the bullet trains. Most of the time, I'm up to my ears in work. My typical day will begin with screening the cardiology inpatient list for heart failure and cardiac rehab for counseling. I'm also involved in calling patients post-discharge telephone call as well as running other cardio clinic.
Wow, looks like you really have a lot on your plate.
Yeah, quite a fair bit, Dr. Mayank. Dr. Mayank, I have to pass our heart failure pharmacy Mr. Saw a document. Would you like to come with me?
Yes, please. Let's go.
Follow me. Hello, Mr. Saw.
Hey, Sister To.
This is a document for you.
Hey, thank you.
Welcome.
Hey, Dr.
Hi, Mr.
Mayank.
Saw.
Hey, how are you?
I'm good.
Yeah. Hey, please have a seat.
Thank you. Could I have a few minutes of your time? We wanted to
Sure.
ask you a few questions about your time here as a pharmacist.
Sure, no problem.
Now, we wanted to check with you, how long have you been here now as a pharmacist?
Wow, this is something I try not to remember. I think it's more than 15 years.
Wow, it's a long time.
Yeah, that's why.
So one of the questions we had for you was, many of our heart failure patients are on a lot of medications. How do you as a pharmacist work with them and enable them to carry on along their journey?
I think communication is really very important to help the patients understand why they're on those medications and what to expect from the medications. And it's really very important to help them feel that they're part of the team that's making decisions for their own health. So which is why actually I like to spend time, talking to patients about their medications and other things as well.
Hey, Mr. Saw, there's a patient waiting for you.
Oh yeah.
Let me let you carry on with your work. Thanks so much for your time, Mr. Saw.
Sure, no problem.
Thank you. See you around.
See you again. Bye-bye.
I hope you guys have had as much fun as I have in meeting the NUHCS heart failure teams across the Kentridge as well as the Jurong Health campuses. Till next time, bye-bye.